Can a broken nose cause sleep apnea? If you've ever wondered whether a broken nose could be linked to sleep apnea, you're not alone. Let's break down the connection between these two conditions. A broken nose, or a nasal fracture, can indeed impact your breathing, especially through your nose. When the nasal septum, the cartilage and bone that divides your nose into two halves, is fractured, it can lead to obstructed airflow. This obstruction is similar to what happens with a deviated septum, where the nasal passages are unevenly sized. When your nose is broken, the swelling and misalignment can make it difficult to breathe through your nose. This might force you to breathe through your mouth instead, which is a common adaptation for people with nasal obstructions. However, mouth breathing during sleep is associated with a higher risk of airway collapse, particularly in cases of obstructive sleep apnea. Obstructive sleep apnea occurs when the muscles in the back of the throat relax too much during sleep, narrowing the airway and causing breathing disruptions. A broken nose can exacerbate this condition by adding another layer of obstruction to the airway. For example, if you already have a tendency for your airway to narrow during sleep, a broken nose can make it even harder to breathe, leading to more frequent episodes of apnea. Additionally, a broken nose can disrupt your normal sleep patterns. The combination of nasal obstruction and increased breathing efforts can fragment your sleep, preventing you from getting restorative sleep. This can result in daytime fatigue and other symptoms associated with sleep apnea. While a broken nose itself does not directly cause sleep apnea, it can certainly make existing breathing difficulties worse. If you have a broken nose and are experiencing symptoms like noisy breathing, frequent awakenings, or persistent tiredness, it's a good idea to consult with a healthcare provider to assess whether you might have sleep apnea. In summary, a broken nose can contribute to the severity of sleep apnea by obstructing nasal airflow and forcing mouth breathing, but it is not the primary cause of the condition. Addressing the underlying issues and treating any nasal obstructions can help improve your sleep quality and reduce the symptoms of sleep apnea.